Good day, ladies and gentlemen. Thank you for allowing us into your homes again. For another episode of your program, let's talk about infertility openly. Today we'll be talking about female infertility. When the factor responsible for inability to conceive in a couple is in the woman, we say there is female infertility. And I was hoping we could talk about this extensively. The contribution of the woman to fertility is massive. The contribution of the man is minimal. Even though, yes, it's a major contribution. For instance, the woman releases an egg. When the egg is released, the egg passes through the fallopian tube. When it passes through the fallopian tube, it now meets the sperm in the fallopian tube. When the sperm and egg are fertilized, it now goes into the womb to attach. So there can be a female infertility from the level of the egg, from the level of the fallopian tube, from the level of the lining of the womb, or from the level of the immune system. And from these four levels, we can have challenges with conception. Meanwhile, in the male, it's just with sperm, we can have a challenge with conception. Most women release eggs regularly, what we call ovulation. But at times, we have eggs not being released regularly. And if your doctor diagnoses this, usually it's not difficult to manage. There's a medication that can be put on and that abnormality can be corrected. A bigger problem will be if the quality of the egg is low. And we have this especially after the age of 37. Because as women grow older, the quality of their egg reduces. And so if the egg is released, but the quality is low, then that's a different issue. We do not have a drug to correct that. Fallopian tube, people ask me all the time, what causes fallopian tube blockage? The commonest cause of blocked fallopian tube is an infection. At times, the woman will be able to tell, I had an infection in the past. At times they don't know, because at times the infection does not have a symptom. And it's important for us to know this, that these things will happen like this. Apart from that, we can also have abnormalities of implantation, in which case the sperm and egg is fertilized, but it doesn't have a good place to rest. It doesn't have a good place to implant. It's like planting a seed. No matter how good the seed is, if the soil is not good, it cannot receive it and it cannot grow. The last way in which women contribute is their immune system. Their immune system needs to embrace the embryo and absorb it. If this does not happen, the women usually manifest as having recurrent miscarriages. And this is a very sensitive thing to do. This is a very sensitive thing to have. As I said earlier, with ovulation disorders, drugs can be corrective. Now, if the fallopian tube is blocked or the egg quality is poor, the best thing to do is what we call an in vitro fertilization, in which the sperm and egg are fertilized outside the body and then return back into the womb. But if the challenge in the couple is miscarriages, either miscarrying in the first 3 months or after 3 months, they need further evaluation. And then when we're able to say that this is the problem, drugs can be recommended. Such women may not even need any form of intervention. It's just a matter of them getting pregnant again and put necessary things in place to prevent miscarriages. We now have a subset of women that miscarried after the 3 months, 3, 4, 5, 6 months, what we call recurrent mid-trimester abortion. This happens many times because there's a weakness in the neck of the womb, and these women may need something to do to tighten the neck of the womb. This is easily treated. I hope you really have learned something from our discussion this evening, talking about female infertility. The list is not exhaustive, but I've managed to touch the major things that can cause infertility in women. Till I come your way again, have a fantastic day.